good evening, everybody. Thank you for tuning in to this class. My name is Tom Maxson, LMBT, and you are watching live from Hands on Health in Cary, North Carolina. I am teaching tonight about sleep. Save our sleep. How can we get better at sleep? Why are we so fatigued all the time? We're going to go over some good information to help you understand that topic and kind of unpack it a little bit. First, I want to mention this type of class is called a drop-in and discover class. We have several more coming up over the next several months. We have those booked out. Next one that we have scheduled is February 19, How to for Pet Massage. It tends to be a very popular class. You need to register early for that one. You can bring your dog in here, so obviously there is limited space to have the animals in here with the owners, and you don't have to have a pet with you to do the class. It's up to you. Just we ask that you have friendly dogs if you bring them in. Other than that, we have upcoming in the end of February 27th, 3 p.m. a TMJ and craniofacial massage class topic. So anybody who has like TMJ headaches, TMJD, major jaw problems, like me, I need to take that class too. It's going to be tips about self-care, how you can, help yourself have less pain ongoing when you're on your own, and what kind of work we can do to help you here in-house. The last thing I want to mention upcoming is Thursday, March the 7th. We have our health partner meet and greet, which is healthcare providers, doctors, medical professionals, health and wellness professionals, fitness professionals. We have kind of an open house here, and you can come in and meet us throughout that day. So all of these you need to call ahead and schedule with us to come in. And let's get going on our class tonight. So who am I? Why do you care what I have to say about sleep and fatigue and getting better sleep, better quality of sleep? My name is Tom Maxson. I am a licensed massage and bodywork therapist in the state of North Carolina. I've been here about 5 months, and I have been practicing massage and bodywork about 15 years total, since 2003 in Florida. And I'm also a certified musculoskeletal alignment therapist, posture and pain specialist, which just means I have some extra training about balancing the spine and the musculature around the spine for the best possible optimal movement and performance of the spine. I am also a 300-hour certified reflexologist. That's kind of a lot of training in the feet and the extremities, hands, feet, face, ears, all fall under the reflexology training that I've had. We are going to delve a lot into reflexology in the next few minutes because it's very effective in helping with sleep problems, sleep disruptions. What else? I have a degree from University of Central Florida in psychology, which focuses on the nervous system and trying to make the brain happy and make your mood better through holistic maintenance of your entire musculoskeletal system, keeping your nervous system happy, which can come from reflexology, from massage and body work. Stretching does a lot of that as well, which you can do yourself. So that ties in a lot to the importance of sleep and how the brain functions with or without sleep, is kind of the expertise I'm drawing from there. I'm also a massage therapy instructor. I teach continuing education classes here in-house at Bodywork Therapy Seminars, which is our education division of Hands on Health. And I also taught entry-level massage therapy at Southeastern College in Tampa, Florida. So I also want to mention, this is just my bullet points of my resume, but when you come in here to Hands on Health, we have so much expertise above and beyond just base level massage therapy. Everyone obviously has gone to massage school, has a licensure, has had extra training, and pretty much any kind of condition or pain, challenge that you're working through, somebody in this building will have some insight for you. So if you have something weird, maybe that normal massage therapists wouldn't be capable of really helping you understand, we here at Hands on Health pride ourselves on education. Education that we have that we can share with you, the knowledge, and also being able to educate you in a way so that it makes sense to a layperson who's not a nerd like me studying neuroscience textbooks all the time in my free time. So, moving on, after that shameless plug, why are you here? Why are you watching? Why are you paying attention to a guy in Cary, North Carolina talking about sleep and quality of sleep? If you don't have a specific, clear motivation or goal that you've set for yourself to increase your health overall, this information isn't going to stick. And that's true with anything you learn. Any class you sit down and take, you need a reason that is going to stick out and help you really digest this and to internalize the information so that you're not just going to walk out the door and forget it. We're trying to look for a long-lasting habit change, and that takes some time and it takes a clear motivation. So has sleep been an issue for you? How long has that been? What kind of challenges has that presented in your life outside of just not being able to sleep in the bed that can filter out into many other facets of your life? So a little bit of my personal history to answer this question, why I started diving into this information. I'm going to be kind of real and blunt for a while. The thing that started this, honestly for me, was erectile dysfunction. I had some problems, and that was really important to me to get more information and to fix that problem. My first, I like to call it grown-up job after high school was that I was a police dispatcher and 911 call taker at a police department. And that was super high stress. And I worked the overnight shift from 7 p.m. to 7 a.m. And usually I would work enough overtime in a week to have 50 plus hours of time worked. And super high stress and very little sleep. And so I would come home and just crash and sleep maybe, 5 hours during the day, during like the brightest part of the day. I had no idea about blacking out windows. I had no idea about sleeping masks. I had no idea about how to make my sleep more effective. So I would just, I was 20 years old. I started when I was 19, just turned 20, 21, 22, 23 is when I worked at this job. And a 20-year-old dude should not have erectile dysfunction. It's not something that should be part of their life. So, and not just in terms of sexual performance, but also not having an edge, not having the motivation to be vital and vibrant in my lifestyle. I had just enough energy to survive the shift or survive the week and then go forward into my weekend, which my days off, I would sleep all night, maybe 14 hours, and then I would still feel miserable, and I would be completely backwards of what my schedule should be. It should have been, I went home for my weekend nights that I was off and stayed up all those nights and slept well during the days, but that didn't happen either. So it took me many years to unravel this and dive into it. And I don't know about you, but sexual performance and general overall vitality is a big driver for me, a big motivator to get this and take hold of it and make it work in my life. So that's why I'm passionate about sharing this information with you so that more people can have a good experience and a healthy, vibrant lifestyle. So, sleep really should be easy for us. It should be the first thing that we think of when we're stressed out, when we're kind of getting sick a little bit, you want to lay down in bed until you feel better. If you're injured or you get hit on the head, you get a concussion, the first thing your body does is, hey, we need to sleep. We need to just knock it out and rest and fix this thing. This is a priority. So strangely, however, in our culture, like American culture, it's the first thing to go out the window. If I have a big project due, I'll just work through it. I'll stay up later, I'll caffeinate more, I'll run around crazier, and I'll sleep later. I'll sleep sometime. This fictitious sometime that never happens, that I'll just chill out and relax for a few days and catch up. But we never really catch up, do we? So, are you one of the 33% of the adult population that is significantly associated with insomnia? According to this study by the Journal of Family Medicine and Primary Care, in 2016, chronic insomnia was seen in 33% of the adult population. Increasing age and diabetes were significantly associated with insomnia. And they go on to say all patients, every patient, especially middle-aged patients and those with diabetes, should be screened for insomnia by a primary care physician. So this is a huge issue. This is big. This is a third of people are struggling with some kind of insomnia. And this is a primary care level thing that needs to be more widespread and acknowledged as a problem, as a challenge that we're facing as a society. What are some of the things that'll happen if you don't sleep? When we do push off the sleep in favor of working harder and burning the candle at both ends, what can happen? Obviously, we're going to be tired throughout the day. It's going to affect how we feel. Day by day, minute by minute, we're going to feel tired, fatigued. You can have difficulty concentrating. You can be irritable. You can have mood disorders. You can become impulsive or aggressive in your behaviors. And all of those things combined are going to create difficulties at work, at school, in your relationships. Everything that you're trying to do can be impaired by not sleeping well. In fact, driving drowsy is almost as bad in some cases as drunk driving. There is that much cognitive impairment that happens when you haven't been sleeping. And these particular bullet points are from the National Sleep Foundation. So what are some suggestions of how we could get some better sleep? This is from the Mayo Clinic. Keep a consistent sleep schedule. That was, like I said, a really hard thing for me when I worked overnight shifts. But you need to sleep the same 8 to 9 hours every night. Hopefully during the night and not during the day. You need to, if you take a nap during the day, if your schedule forces you to sleep a little block at night and you need a nap during the day, make it the same time every day. Keep your naps and your bedtime sleep at night consistent, the same times all the time. They've also found daily exercise, as long as you don't do it right before bedtime, exercise is going to help you sleep better, get deeper sleep faster, and we're going to talk in a few minutes about hormonal effects of good sleep. And this plays into the cycle of rebuilding your tissues, and testosterone and human growth hormone all play into exercise. So whatever kind of exercise you do, some studies have shown that 7 a.m. is the best possible time for you to get the best benefit of the exercise on your sleep quality when you do go to sleep at night. So do some exercise, be it weightlifting, resistance training, or more cardio-based, whatever it is, do some every day. Eat lighter later is another good tip. Don't fill up on a big dinner. Don't eat a lot of heavy desserts after dinner. That one gets me a lot too. I had a lot of problems with growing up eating like ice cream every night, or some kind of dessert after dinner, which would be like 8 or 9 at night. That's way too late. Your body should be winding down from digestion and all this stuff. It should be done by like 7:30 would be optimal. So eat your big meal earlier in the day and eat lighter later. Obviously, I barely have to mention it, take control of your caffeine intake. If you're drinking a whole lot of coffee, back that down, switch to green tea, switch to something decaffeinated, half and half. You might have to wean yourself. You're gonna have headaches, yes, but it's vital that you take control of caffeine and don't let it control you. We talked about naps a bit, limit how your naps go if you're having problems. And the last thing, I added obviously, massage and reflexology, because I'm way biased in that direction. But Mayo Clinic says be proactive about your pain management. If you have pain, body pain, low back pain, leg pain, restless legs, headaches, neck, shoulder tension, TMJ pain, all that stuff that comes out at night, the like grinding teeth and kind of thing, be proactive about that. Seek out professionals who can help you with pain. And of course, I'm going to say you should get a massage or a reflexology treatment, or seek out someone with a holistic worldview instead of just getting some drugs from the doctor, because sleep aids are not very helpful and they're highly addictive. And like there's an opioid epidemic and all these other problems with a lot of the painkillers on the pharmaceutical side. So I would go, if you can, unless you're super severe or you need like actual mental health counseling or psychiatry, start with the holistic side, alternative medicine side, and see how much that helps. And if that falls through, then go to a more medical model. But again, that's my opinion. I am not a medical professional myself. I am a massage therapist. So again, I'm biased, and don't get upset that I said that. So talking about reflexology, I am also super biased towards the reflexology side of body work. And so I'm gonna try to not ram this down your throat, but there are several studies that have shown where reflexology has greatly improved quality of life, quality of sleep, less fatigue, with all kinds of populations, all kinds of medical conditions, cancer patients, rheumatoid arthritis, liver patients, dialysis, kidney, prenatal, postnatal. There's all these studies, and definitely ask me questions. I can send you links to all this information if you want it, or you can just take my word as I run through some of the highlights here. Number one, results showed plantar reflexology improved significantly the quality of sleep. Number two, after receiving foot reflexology therapy, the subject showed significant pain relief and improved sleep. Number three, the application of reflexology induces changes in the activity of brain waves, producing a high degree of sleepiness and sleep. These are direct quotes, by the way, from peer-reviewed journal articles. Next one, foot reflexology is a useful nursing intervention to relieve fatigue and to promote sleep. It can be concluded that foot massage has a desirable effect on sleep quality and can be executed by a trained as a useful way to improve the sleep quality of patients. But wait, there's more. Next up, reflexology is an effective non-hormonal approach for treatment of sleep disorder. Over the course of this study, women reported significant decrease in sleep disorder for the remainder of the trial. Bottom of this page, foot reflexology and back massage were shown to improve the sleep quality and reduce the fatigue of hemodialysis patients. So you're seeing the trend here. Reflexology is a simple and effective non-pharmacologic nursing intervention that can be used to help manage pain and fatigue in patients with rheumatoid arthritis. Last one, I think. Significant effect of reflexology on improving the quality of sleep in elderly women undergoing surgery. So, some of the hallmarks of good science is that it's expandable to a large variety of populations of people, all different kinds of conditions, all different parts of the world, different sexes, different age groups, and they've actually done some good work on this, and it's growing research. This is all in the last 5 years this research has come out, and thankfully, thanks to Google Scholar and all these other sources online, you can find this good information. So, as I said, we are going to talk a little bit about testosterone and why it's so important. Both men and women have testosterone in their system. A lot of people kind of misconstrue that particular hormone as being just a manly hormone, and that's not true. We have very similar hormonal profiles in terms of what's in our bloodstreams, male to female, but the amounts are very different. The levels of each one and the ratios are very different. In both cases, testosterone is a big driver for sexual performance. And as I said, it's also associated with vitality, just having a competitive edge. You might have heard about like teenage boys having a super competitive streak because they're just coursing with testosterone in their systems. Brothers, teenage brothers, for example. And that's true. That's coming from that testosterone, and that gives us drive. It gives us motivation. It gives us mojo, if you will, for another word. And the important part of this, why we're talking about it today, testosterone only produced during deep sleep. So not even during a nap or a short, brief cat nap. You need deep, quality sleep to have a good amount of production of testosterone. And that's huge to know that. That was one of the big things for me in my life personally that really just explained so many things. Why my life was falling apart because my health was just disintegrating. Because it may be more important than even sexual performance, testosterone is all about rebuilding and restoring your body, your muscle tissues, connective tissue, everything that gets broken down during the day, everything you're working out and exercising, and everything that maybe is injured. You need that particular hormone to rebuild yourself. While you're sleeping, testosterone is produced and it's used while you're sleeping. You can't store testosterone in your body. After you wake up, it breaks down into estrogen. And it can't go back. It cannot go from estrogen form into testosterone. It only starts as testosterone, has to be used up while you're sleeping, or it's turned into something else in your body during the day. So this is huge information and so powerful to my personal life and to so many other people who have challenges like these with chronic fatigue, with ongoing challenges with just not having any energy, not having any drive to do things. And the last thing, testosterone is directly related to like abdominal belly fat, which has been shown visceral fat is not very healthy. There are a lot of problems when people have a lot of visceral fat, and that's a topic for another night. But you really aren't going to get very far if you're exercising and trying to lose weight without proper testosterone production, which comes from healthy sleep. And I'm going to pound this in the ground a little more. According to Dr. Shafiq Qadri, in his book, which is excellent, The Testosterone Factor, quote, "Sleep is when you strengthen your bones, muscles, memories, blood, sperm, and new learning. It's when your onboard diagnostics and your immune system self-heal and detoxify. It's when you repair both physical and psychological wounds. It's when you grow physically and psychologically." That's incredible how many things that one hormone is involved in. Another quote from the same book, Dr. Qadri. "Testosterone leads, triggers, oils, oversees, contributes to, mediates or is involved in all of these restorative processes that we just talked about. The better you sleep, the more testosterone shines. As this hormone level rises, it also promotes other brain chemicals important for quality sleep, including melatonin, serotonin, and human growth hormone. So it's a self-perpetuating cycle. You sleep well, you have more testosterone, you sleep even better the next night, and you sleep even better the next night. It's a cycle. You build every night on a foundation. So while we're talking about human growth hormone that I just mentioned, this is another one. Only produced during sleep. Only produced during deep sleep. So if you're in the gym lifting weights and trying to get big and swole and pack on mass, you're not going to do it if you're not sleeping. If you are getting up at 4 in the morning to go to the gym to lift weights at the expense of quality sleep time, you're shooting yourself in the foot. You're not going to get your results that you're looking for. You're doing a lot of hard work, but if you don't sleep it off, you're not going to get there. It's not going to work. It's not going to happen. So HGH, like testosterone, rebuilds and restores tissues, especially in the muscles. It helps you control weight, especially abdominal fat, and you have to have it. You have to have production of HGH and testosterone to get there, to get physical fitness. It really is almost impossible without the good sleep driving those two hormones. So, moving on. What are some things, some practical tips that you can use to get a better night's sleep? There's several things you can do to control your environment. We have several senses that are directly related to sleep that we can talk about, and I'm going to, we could go at great length. There are probably hundreds of tips and tricks you could use. And I could put some links in the bottom about some of the sources that I got for these, but to me, these are the quickest, easiest, cheapest kind of hacks to get a good night's sleep. If you wanted to help yourself right now tonight get a good night's sleep, this is what I would do. I would utilize some kind of white noise, meaning turn on a little fan, get a white noise machine, get something that makes, like wave sounds or staticky sounds or something, heartbeat sounds. They have all kinds of devices that do that. They have apps for your phone that do that. Or if it's, safe, I have small children, so I can't really wear earplugs without feeling like I might miss something bad that happens at night. So if you feel it's safe in your environment, I would put in earplugs and just shut out the outside noise. Some people can't handle that. My wife, for example, hates having earplugs in her ears. Her own heartbeat going in her ears drives her nuts. So again, all this stuff, do what works for you, because I don't know you. You need to do whatever is going to work to get your sleep and to meet your goals. You can play relaxation music, either in headphones or if you have music that the whole room likes. I love, for example, because I'm a massage therapist, I'm in a room all day listening to quote-unquote relaxation music. I don't want to go home and listen to any more music that's the same, like new age sounding, real ethereal kind of stuff. So I love blues music. I like old-timey 20s, 30s, 40s, like Delta River blues music. So that puts me out. But I can only listen to that in headphones because my wife does not like it. She's like, that keeps me up. That's crazy. Why would you even relax with that? So, she likes something else. So if we are sleeping together with the baby, co-sleeping with us, we need something that, if we're going to play music in the room, is conducive to everybody being relaxed. So, again, use that information, work with it as it works for you. You can use several kinds of scents, essential oils, aromatherapy, diffusers, humidifiers that have diffuser places you can drop drops into. Your sense of smell is directly tied to memory, and the closest tie to memory of any of the other senses in your body, in your brain. So you can, because sleep is when your short-term daily memory is being translated into longer-term memory, long-term storage in your brain. If you have a specific scent that you have every time you go to bed, for example, chamomile tea. I love drinking chamomile tea before bed because that fragrance just relaxes me. It's been years and years and years. I've been training myself, training my body, training my brain to start producing relaxation chemicals when I start smelling the tea and it gets close to me, which I do consistently. 7:30 every night I'm making the chamomile tea, for example. So any of these smells or fragrances that you can use consistently, always, 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 in the same way, at the same time every night, your body is going to get trained to start the sleepy cycle without having to work so hard at it every single night, the more you do it consistently. Seems obvious, but I didn't know it for many years. Use an eye mask. You just gotta block out the light. Any kind of light triggers your brain that it's daytime. And we have so many devices now, so many blinky lights, so many charging cords that have a bright green light or a bright blue light on this laptop over here or something. You know, there's always flashing lights going off in our bedrooms, in our houses, on our TVs. Please take the TV out of your bedroom. That's going to be a big help. Just say that right off the top. Don't know if it's going to happen, but personal advice, take the TV out of your bedroom. But if you have to have something with light on it in your room, make sure it has red light. If you need a night light to be able to see, if you need like a candle or a flashlight, do not pick up your phone and turn on the really super bright white flashlight, because that's going to flood your eyes with stimuli that's going to tell your brain, oh, we need to be awake. We need to shut down the melatonin and ramp up the stress hormones to start getting things cranked up and wake up in the morning. Cortisol is a stress hormone that your body uses to wake you up in the morning, kind of like coffee, but we have overused our adrenal glands and pushed them so hard for so long that we need even more stimuli than our body can produce to wake us up, which is part of the cycle of problem. So the last thing about your environment would be control your temperature. Control the air temperature in the room. At nighttime, our bodies respond well to colder air temperature. Maybe 65 degrees is optimal in the room if you can do that. And also internally, your core body temperature cools down a bit at night, so while you're in deep sleep. So if you can give it a head start by drinking some ice cold water before bed, that cold liquid gets down in your core, and that triggers that same process in your brain. Is thinking, oh yeah, that's what I do when it's sleeping time. That's what I do at night, is I get cooler down there. And you reminded me by drinking ice cold water right before bed. So some hopefully very practical, useful tips for getting to sleep better tonight. Moving on. There are several things you can do to take care of your own feet at night or with a partner. And I'm going to do a demonstration later on some live feet. I don't have anybody in the room with me right now, so there are a lot of things you can do. One thing would be rolling your feet on a tennis ball is the last one on here. that has been actually shown in research studies to loosen the muscles of your low back and relieve low back pain by rolling the arch of your foot on a tennis ball for a few minutes. So back to proactively managing pain, you can take care of your feet at night and get into a spa-like routine. And like I said, we'll demonstrate that later on another video, so you can see exactly what I'm talking about. So that is the information that I have for you tonight. If you do have any questions, feel free to write them there in the comments on the Facebook Live video. This will be shared onto YouTube as well later. Please engage with me. Please continue this discussion. This is way too important to just let it fizzle out. If you have any more like topics, subtopics of sleep that you are interested in, that hopefully I can maybe do some more research and fill this out and give you some more info, that would be great. Let me know. I would love to hear from you. So thank you so much for listening. My name is Tom Maxson, LMBT, and this is Hands-On Health in Cary, North Carolina.